Thank you very much, Mr. President, and thank you to the chair of the Budget Committee, who I think has done an excellent job. And while I appreciate the comments of my colleague from South Dakota, I actually think that in order to deal with the budget challenges facing the country, we've got to look at both revenues and spending. And one of the areas of spending that's been the most problematic is health care costs. It's one of the fastest growing costs for the federal government. And what we need to do is look at how we can lower those health care costs. The amendment that I've proposed that we're going to be voting on this morning, it's amendment number 438, is one of the things that actually reduces health care costs. In the 3 years since the Affordable Care Act was passed, women's access to affordable health care has improved. Women now have access to a wide range of preventive services, things like well women appointments, screenings for cancer, diabetes and HIV, and counseling for domestic violence. All women now have access to contraceptive coverage for free through their insurance plans. 99% of women report that they've used birth control at some point in their lives, and access to birth control is directly linked to declines in maternal and infant mortality. I think that's a really important message that we need to get across to people. There is a direct connection between access to birth control and maternal and infant mortality. Access to birth control can also reduce the risk of ovarian cancer. It's linked to overall good health outcomes. Sadly, the United States has one of the highest rates of unintended pregnancies in the industrialized world, and preventing unintended pregnancies just makes fiscal sense. Studies have found that medical services to women who experience unintended pregnancies and to infants who are born as a result of such pregnancies can cost taxpayers up to $12 billion a year. My state of New Hampshire has one of the lowest teen birth rates in the country. As governor, I was proud to sign a law that required health care plans to cover contraception. It was a law that passed with overwhelming support, bipartisan support in our legislature. The fact is that accessible family planning matters, and it can make a difference. Despite the research that shows that investments in women's health make sense, we continue to see efforts to deprive women from receiving the most basic of care. The amendment that I'm going to be offering this morning will protect women's access to primary and preventive health care, to family planning, and to birth control. At the most basic level, this amendment ensures that a woman's family planning decisions are ones that she makes with her doctor and her family, and that they are not dictated by government or by her employer. Improving.
The senator's time has expired.
Thank you. So I hope my colleagues will support the amendment.